when I teach implant courses to other doctors, a lot of the times they're taking courses from us to know more about the technology, what's available. So what I have to do is always be on the top cutting edge of knowing what's available, which is very advantageous to our patients because I need to know about it, what all the technologies are available out there, but I also know the downfalls to all the technologies. And so I get to figure out what technologies we should incorporate, and what technologies we shouldn't incorporate. Because just because it's new and the new, shiny nickel out there doesn't mean it's the best thing that you can do for your patients. And so we've gone through a lot of the technology, making sure we do all the research on all technologies to make sure we know what's best out there. And when we find something that's really good for our patients, we incorporate it. So we've added 3D technology, some of the new facial technology, able to 3D facial scan, intraoral scanning, and making sure we know the best technology out there. Have you gone to the dental office where you've looked around and said, are they really up to date? So when we look at our technologies that we have, are continually updating ourselves and trying to make sure we are on the cutting edge in all areas and making sure that we provide the best care in the best way for all of our patients. We're also patients as well, and if I'm sitting in the chair, I want to make sure that we're providing the best care that I could have, and the best care my family can have, and the best care my patients can have. We have so many areas in our practice where we've invested in technology, even from the beginning of how you come into our office, technology online, to the technology with how we find the veins for starting access for IV, using a vein finder, a laser. Boy, there's so many areas that we do, even how we give shots, even giving injections, we use technology that helps to reduce the pain for the patients. So there's so many different areas where we try to make sure we invest in the right way for our patients to make sure they get the best experience, the best outcome. I do a lot of the pre-planning of all of our surgeries three-dimensionally. So having a cone beam CT X-ray, three-dimensional, having intraoral scanners that we can scan the mouth intraorally and create a three-dimensional figure there, and combining those two together, planning all of our surgeries ahead of time, knowing exactly where every implant's going to be, every toot's going to be before we ever do the surgery, saves the time in the chair for the patients and creates a better outcome in the end. And we started investing in this a long time ago, from being able to do crowns in the same day. Years ago we began that process, and I became a mentor for other doctors in being able to create in-house crowns ourselves, to creating full mouth implants in the same day as well, so that patients can have a better outcome as well, and save some cost as well, because we could do everything in-house rather than sending things out to a lab and having them send things back to us that maybe we don't like or the patient doesn't like. We get to control it all. That way the patient has a great outcome. So I teach implant classes. I teach courses to other doctors, and one of the things that I would say is that you do not do any implants without having a cone beam. So if I was to walk into an office that says they do implants, that they don't have 3D CBCT, I would run, because there's so many things that could go wrong. And we've been placing implants such a long time that we had to place them in the day we didn't have CBCT. So you had to do it without knowing all the information that we can today when we do implants, and you're taking a chance. And you may not have the outcome that you want, because they don't have the information that they need to have to do it the best. So if you haven't been to the dental office in a long time, we want to invite you to come to our office and see how things have changed, and so we can help you create a beautiful smile. And so for more information about new smiles, click the link below.